Hi, I'm Ashley. I'm your nurse today. Can I see your ID band?
Sure.
Thank you. Can you tell me your name and date of birth?
Karen Harding, January 13, 1969.
Okay, good. Can you tell me what today's date is?
April 24th, 2014.
Okay, and where are you at right now?
I'm in the Troy School of Nursing.
Okay, are you in any pain?
No
Okay,
pain.
so a 0 on a scale of 0 to 10?
Yes.
Good. Okay, the skin looks good. There's no deformities. The patient looks steady at age. There's no wounds. The skin on the entire body is good moisture, good color, good temperature. Okay, I'm going to check your temporal pulses. Good. Good. Now your carotid. Okay, and then turgor is good. Okay, if you'll look at that object back there on the wall for me. I'm going to check your visual acuity. Good. Good. And now if you'll look at my finger. Okay. And then now if you'll follow my finger with just your eyes. Good. Okay, if you'll stick out your tongue. Okay, and then do it side to side. Good. Okay, now I'm going to check your gag reflexes. If you'll stick out your tongue one more time for me and say ah.
Ah.
Okay, good. Gag reflex is good and uvula looks good. Okay, if you'll shrug your shoulders for me. Good. Now if you're pushing against my resistance. Good. Now this way. Good. Okay, I'm going to come around and let's see. Trachea is good in midline. Okay, I'm going to come around and check your thyroid. Good. Now if you'll turn to the left and swallow. Good. Turn to the right and swallow. Good. Okay, I'm going to listen to your breath sounds. If you'll take deep breaths for me. Okay, breath sounds sound good. In your trachea and larynx, you have your bronchial breath sounds, and they are high pitch and high amplitude. And then over your major bronchi, you have your bronchiovesicular. They're a moderate amplitude and moderate pitch. And then in your lower lung peripheral, you have your vesicular, and it's a low pitch, low amplitude. Go swing around this way for me so I can check your back breath sounds. Okay, if you'll take some more deep breaths for me. Okay, breath sounds good. Okay, if you'll cover your left ear, I'm going to whisper 3 characters, and if you'll repeat them after me.
A32.
Good. Now if you cover the other ear.
WX1.
Good. Now you can lay back for me. Okay, if you will smile for me, and then clench your teeth, puff out your cheeks, and then wrinkle your forehead. Okay, good. Now I'm going to listen to your heart sounds.
Okay.
You have your aortic, pulmonic, Erb's point, tricuspid, and mitral, and then I'm going to listen with my bell. Okay, and now I'm going to listen to your apical pulse for 1 whole minute. pulse sounds. Good. Okay, and now I'm going to listen to your abdominal, into your bowel sounds. Good. I heard bowel sounds in all 4 of your quadrants. And now I'm just going to lightly palpate to see if there's any abdominal distension. No abdominal distension and no distension of the bladder, which is good. Okay, there's no signs of edema or tremors on either arm, which is good. Right here you have your brachial pulse, your radial pulse, and your ulnar pulse. Check for, there's no clubbing, capillary refills less than 2 seconds, good. Okay, now if you will grab both hands and squeeze, good. Bilateral is good. Okay, and then there's your legs, no signs of edema, no signs of tremors. You have your popliteal pulse, dorsalis pedis, and then underneath you have your posterior tibial. Okay, capillary refill, good, less than 2 seconds. If you'll push against my hand, good. Push against my hand, good. Push up, good. Push up, good. Okay, let me think. Anything else? Okay, you have your femoral pulse in this area. It's a 2+. It's just below the inguinal ligament, and it is between the pubis and the iliac spine.
Okay.
Okay, and the doctor will be in just a second.